it's time to give voice to the silent. Join me every week on Troubleshoot, where we do exactly that. Have you experienced something you can't speak about? Or maybe you thought no one was there to listen? Every day people are facing issues with mental health, substance abuse, relationships, and more. We here at Hulchul TV care. It's time to break down these barriers, and it's time to give voice to the silent. Join me every week on Troubleshoot, where we do exactly that. Have you experienced something you can't speak about? Or maybe you thought no one was there to listen? Every day people are facing issues with mental health, substance abuse, relationships, and more. We here at Hulchul TV care. It's time to break down these barriers, and it's time to give voice to the silent. Join me every week on Troubleshoot, where we do exactly that. Have you experienced something you can't speak about? Or maybe you thought no one was there to listen? Every day people are facing issues with mental health, substance abuse, relationships, and more. We here at Hulchul TV care. It's time to break down these barriers, and it's time to give voice to the silent. Join me every week on Troubleshoot.
Is Halcyon to speak out about her experiences. Can she see and hear me now?
Shoot, where we do exactly that. Have you experienced something you can't speak about? Or maybe you thought no one was there to listen? Every day people are facing issues with mental health, substance abuse, relationships, and more. We here at Hulchul TV care. It's time to break down these barriers, and it's time to give voice to the silent. Join me every week on Troubleshoot, where we do exactly that. Have you experienced something you can't speak about? Or maybe you thought no one was there to listen? Every day people are facing issues with mental health, substance abuse, relationships, and more. We here at Hulchul TV care. It's time to break down these barriers, and it's time to give voice to the silent. Join me every week on Troubleshoot, where we do exactly that. Have you experienced something you can't speak about? Or maybe you thought no one was there to listen? Every day people are facing issues with mental health, substance abuse, relationships, and more. We here at Hulchul TV care. It's time to break down these barriers, and it's time to give voice to the silent. Join me every week on Troubleshoot.
It's lagging.
Welcome to Troubleshoot. I'm your host, Divya Rajan. It can be daunting to seek help from healthcare professionals. A patient needs security and assurance that they're being taken seriously and heard. So what happens when that confidence is taken from us, when the healthcare system can't give us that assurance? This leaves women feeling they haven't been taken seriously, and instead they feel judged and unheard. So today I want to dive into this topic. Here with me today is Halcyon to speak about her experiences. Hi Halcyon, how are you?
Hi, Divya. Thank you for having me. I'm well. How are you?
I'm good. So why don't you tell us a little bit about yourself?
So my name is Halcyon. You can call me Hal. I'm 25 years old. I use she and her pronouns, and I was born and raised in Toronto. I recently graduated with a master's degree in educational leadership and policy from Loisy. And I tutor ESL and English for work, and I also facilitate consent discourse workshops at schools around the GTA. I love to draw and write poetry. My work has been showcased by the University of Toronto and for mental health advocacy in Canada and the United States.
That's pretty impressive. It's so great to have you here today. So as you heard in my introduction, we're talking a little bit about our experiences with healthcare professionals as women. I wanted to talk to you about your experiences. What have you experienced with healthcare professionals in this regard?
Yeah, so I do want to share how my BFRB was approached by a dermatologist a few years ago For anyone who doesn't know what a BFRB is, it stands for Body Focused Repetitive Behavior. This can be anything from nail biting to skin picking to hair pulling. In my case, I tend to overfixate on and touch my skin rather than just letting acne or other imperfections run their course. I figured that if I wanted to curb my BFRB, I should treat my skin so there'll be nothing. So, I went to my family doctor who referred me to a dermatologist, and I waited for almost a year, as you usually do for specialist appointments in Canada. And I remember feeling nervous, but also excited because I was looking forward to getting the help I needed and becoming one step closer to reducing my acne and ultimately my BFRB. So I got there on the day of, and I just remember it being a complete disaster. I explained my situation to the dermatologist, and she essentially dismissed my problem altogether. She didn't have any knowledge about what BFRBs are, which I find understandable if you are the general public or the average person, because it is a highly stigmatized condition and rarely talked about. But I was actually expecting a healthcare professional who specializes in skin to A, have the knowledge about it through their schooling and practice, and two, not be so judgmental.
Right. And how did you feel that she was judgmental? What was her tone with you?
Just very hostile. I went there and she barely even looked at my skin. She didn't seem like she wanted to see me. It was just a negative vibe. I was just getting negative energy from her.
And at the time, how did you respond to this situation?
Oh, I remember feeling very small, hopeless, and embarrassed. I've obviously I've come a long way since then, but as someone who is seeking help for something that they are insecure about and facing this, it was very disheartening. Her remarks made me feel ashamed for something, I was vulnerable enough to put my pride aside and seek help for. She was saying things like, well, why are you here? You should see a psychiatrist and be on medications. And not knowing that I had actually tried that in the past. And there is no curable medication for BFRBs just because, again, it is stigmatized. So there's not a lot of research about it, and any research that there is on it is new. So it hasn't been advanced to the point where they are giving concrete medication to cure it. Other than that, it just felt like I was having a contest with her because I found myself justifying my behavior and trying to convince her that BFRBs did not equal weakness or even stupidity.
Right. And I'm so sorry to hear that you had this type of experience. How did this affect your relationship and trust with your healthcare providers?
She didn't really prescribe me anything that I hadn't used in the past, like salicylic acid and benzoyl peroxide and all that. She was prescribing stuff that I'd already tried. At this point, I've done my research online and tried all sorts of stuff. So it got to the point where at the end, I was sitting on the examination table thinking wait, are we done? Where did she go? Because the dermatologist, she just walked out of the room without saying bye or telling me to follow up with her in a couple of months. I didn't get a sense of direction or closure. And as I was leaving, her receptionist asked me if I wanted to book a follow-up appointment. And I didn't even know if I had to, nor did I honestly want to at that point. I just remember leaving the appointment thinking, what on earth? I was shocked and traumatized, and it just made me feel like she didn't care about her patients, or me in particular. I took it personally at the time. There I really think there was a lack of respect to me, and how she handled the appointment made me feel like she treated me like that because she thought that having a BFRB meant that I lacked self respect. And that's just such a horrible way of thinking about health concerns that patients have. And I think as healthcare professionals, there should never be that kind of misinformation or stigma towards a patient. And
Especially towards a
yeah,
patient,
like
because as you said, it discouraged you from making a second appointment with her.
for sure, for
How would
sure.
you
I
have
did
liked
not
her
want to
to
see her
respond to
after
the
that.
situation?
You know, it was really scary and difficult to reach out for help in the first place. And this is the case for many hair pullers and skin pickers because of, again, the stigma. And it's one thing to not know about the condition as a doctor, but it's another to be hostile to the patient about the issue that they are dealing with. And I would have appreciated it a lot more if she admitted that she didn't have that knowledge and we could have both used it as a teaching moment. Um, you know, I've graduated with a Master of Education, so I take any learning opportunity as a gift. I would have happily provided her with that, and I'm sure she would have returned the same favor. She could have learned about BFRBs, and I could have gained insight from her expertise regarding things like how to treat wounded skin or how to fade scars faster. And going and getting the solution that I was initially there for, which was like how to stop the acne that I was getting. And I just would have liked her to be more compassionate and ask questions about what she didn't know rather than make rude remarks based on ignorant assumptions.
Of course, I don't blame you at all for that response. I'm really sorry for your experience. Did this affect the way you, or how often you go to the doctors now, especially for this condition?
The incident definitely hindered me from seeking help for a really long time after that. I lost respect for dermatologists after that and thought, well, if they fixed my acne, they won't be making a profit off of me anymore. And there was like all sorts of things going through my head just because I didn't get that closure from her. I didn't know why she didn't want to treat me. There wasn't really clear communication. So I thought like that was the dermatologist's intention, not to help me, just so that she can keep benefiting off of me. But it wasn't until last year during the pandemic where, you know, I thought I have this time, maybe I should try this once more. I'm gonna give it one last time. And my family doctor referred me to CAMH, who then sent me to the Frederick Thompson Center at Sunnybrook Hospital. And they have a program that specializes in the research and treatment of BFRBs. And they had weekly online meetings in which I slowly became comfortable sharing my experiences with other people who have BFRBs. And yeah, there was like there was a psychiatrist that was running that program, and she was knowledgeable about the associated issues. And
Oh, we seem to have lost Halcyon.
जिंदगी मुश्किल तो है। मंगल, शनि, राहु, केतु, भूत, प्रेत, जिन्न, किसी की बुरी नजर, घर परिवार या व्यापार में भी मुसीबतें, घर और काम पे वास्तु दोष, सिगरेट, शराब या किसी और नशे की आदत। हल है, मुझसे बात करें। मैं और आप मिलके ढूंढ लेंगे रास्ते। डोंट वरी, विल फिक्स इट।
काव्या होम्यो केयर काफी इलाज जहां बेअसर हो जाते हैं, वहां से शुरू होता है होम्योपैथी का असर। बच्चों से लेकर बुजुर्गों तक, नए से लेकर कई पुरानी बीमारियों तक, जैसे एलर्जीज, एस्मा, आर्थराइटिस, हेयर लॉस, स्किन डिसऑर्डर्स, माइग्रेन्स, मेल या फीमेल हेल्थ इश्यूज, डाइजेस्टिव डिसऑर्डर्स या पाइल्स, मेंटल हेल्थ इश्यूज, हार्ट प्रॉब्लम, डायबिटीज और फॉर एनी काइंड ऑफ एक्यूट और क्रॉनिक डिजीजेस हमारे होम्योपैथ से मिले, जिनको 20 साल का लंबा तजुर्बा है। काव्या होम्यो केयर, जहां से शुरू होता है हेल्दी लाइफ का सफर। 6477602779। काव्या होम्यो केयर। काव्या होम्यो केयर काफी इलाज जहां बेअसर हो जाते हैं, वहां से शुरू होता है होम्योपैथी का असर। बच्चों से लेकर बुजुर्गों तक, नए से लेकर कई पुरानी बीमारियों तक, जैसे एलर्जीज, एस्मा, आर्थराइटिस, हेयर लॉस, स्किन डिसऑर्डर्स, माइग्रेन्स, मेल या फीमेल हेल्थ इश्यूज, डाइजेस्टिव डिसऑर्डर्स या पाइल्स, मेंटल हेल्थ इश्यूज, हार्ट प्रॉब्लम, डायबिटीज और फॉर एनी काइंड ऑफ एक्यूट और क्रॉनिक डिजीजेस हमारे होम्योपैथ से मिले, जिनको 20 साल का लंबा तजुर्बा है। काव्या होम्यो केयर, जहां से शुरू होता है healthy life का सफर। 647760।
So Halcyon, moving forward, how did this affect how often you went to the doctors, especially for this condition?
This incident definitely hindered me from seeking help for a really long time afterwards. I lost respect for dermatologists after and thought, well, if they fix my acne, they won't be able to profit off of me anymore. And that's just a really horrible way of thinking. But the way in which that appointment left me like with unanswered questions, open-ended, a lot of things ran through my mind and they weren't entirely positive. I really thought that the dermatologist intentionally did not help me for those reasons. And, it wasn't until last year during the pandemic that I thought, I'm going to give this one more shot, one more, and we'll see how it goes. And my family doctor referred me to CAMH, who then sent me to the Frederick Thompson Center at Sunnybrook Hospital. And they have a program that specializes in the research and treatment of BFRBs. So they had weekly groups in which I slowly but surely became comfortable sharing my experiences with other people who had BFRBs, but also with our facilitator, who was a psychiatrist that was knowledgeable about the associated issues. So when I mentioned this nightmare story, she referred me to a dermatologist who was knowledgeable about BFRBs. And let me just say, if one doctor isn't right for you, please do not give up. My experience with the first dermatologist and the new one was literally a difference between night and day. Our appointment was through the phone because of the pandemic, and it was still 1,000 times more productive and helpful than when it was in person with the other dermatologist. And he ended up switching my birth control, and he put me on one that was supposed to, curb acne and lessen acne and all sorts of stuff that have to do with hormones. And we were able to have a productive conversation about BFRBs and their barriers within the healthcare system. And something he did that really stuck with me, I told him that, people just tell me, like, why can't you just stop engaging in this behavior? And he said something along the lines of, oh yeah, if it was that easy, you would have done it by now. And I just really felt understood, and he was caring. I was just left on a really good note. He is retiring, but that's not where he left me off at. He made sure that I was set for a follow-up appointment with another dermatologist who also understands my specific situation. And yeah, it was just really refreshing, and I'm a little more hopeful now.
Thank you so much for sharing your story. It's very brave of you to come here and speak and even go out and seek help. I'm very happy that your story had a happy ending, and hopefully people watching today will take your advice. Thank you so much. We'll be right back after these commercial messages.
779. Kaavya Homeo Care. काव्या होम्यो केयर काफी इलाज जहां बेअसर हो जाते हैं वहां से शुरू होता है होम्योपैथी का असर। बच्चों से लेकर बुजुर्गों तक, नए से लेकर कई पुरानी बीमारियों तक, जैसे एलर्जीज, एस्मा, आर्थराइटिस, हेयर लॉस, स्किन डिसऑर्डर्स, माइग्रेन्स, मेल या फीमेल हेल्थ इश्यूज, डाइजेस्टिव डिसऑर्डर्स या पाइल्स, मेंटल हेल्थ इश्यूज, हार्ट प्रॉब्लम, डायबिटीज और फॉर एनी काइंड ऑफ एक्यूट और क्रॉनिक डिजीजेस हमारे होम्योपैथ से मिले, जिनको 20 साल का लंबा तजुर्बा है। काव्या होम्यो केयर, जहां से शुरू होता है हेल्दी लाइफ का सफर। 6477602779। काव्या होम्यो केयर। काव्या होम्यो केयर काफी इलाज जहां बेअसर हो जाते हैं वहां से शुरू होता है होम्योपैथी का असर। बच्चों से लेकर बुजुर्गों तक, नए से लेकर कई पुरानी बीमारियों तक, जैसे एलर्जीज, एस्मा, आर्थराइटिस, हेयर लॉस, स्किन डिसऑर्डर्स, माइग्रेन्स, मेल या फीमेल हेल्थ इश्यूज, डाइजेस्टिव डिसऑर्डर्स या पाइल्स, मेंटल हेल्थ इश्यूज, हार्ट प्रॉब्लम, डायबिटीज और फॉर एनी काइंड ऑफ एक्यूट और क्रॉनिक डिजीजेस हमारे होम्योपैथ से मिले, जिनको 20 साल का लंबा तजुर्बा है। काव्या होम्यो केयर, जहां से शुरू होता है हेल्दी लाइफ का सफर। 6477602779। काव्या होम्यो केयर। काव्या होम्यो केयर काफी इलाज।
जिंदगी मुश्किल तो है। मंगल, शनि, राहु, केतु, भूत, प्रेत, जिन, किसी की बुरी नजर, घर परिवार या व्यापार में भी मुसीबतें, घर और काम पे वास्तु दोष, सिगरेट, शराब या किसी और नशे की आदत। हल है, मुझसे बात करें। मैं और आप मिलकर ढूंढ लेंगे रास्ते। डोंट वरी, विल फिक्स इट।
And now we have Jess Sagal, a healthcare provider affiliated with acute care in a GTA hospital. Welcome, Jess. How are you today?
Oh, thank you. Thanks for inviting me over. How are you doing, Divya?
I'm doing great. So we're here to talk a little bit about women and how they receive healthcare. In your opinion, do you think healthcare professionals sometimes do not take women seriously?
I'm not sure whether I should use this sentence, whether the patient as a woman is being taken seriously or not. What I have seen is I've been a nurse from last 23 years, and I have worked in different settings in the GTA, different hospitals. What I have noticed is that especially one factor is the pain. When pain is taken probably more for the gender based, where a woman expressing about the pain is taken less seriously as compared to the men complaining of pain. But otherwise, honestly, I have not seen much difference of providing a care from the healthcare professional. When I say healthcare professional, I'm talking about the doctors or nurses or any allied health workers based on the gender, that the woman is getting a less care. But yes, as from their assessment, when a woman say pain and a man say pain, the man is taken a little bit more seriously than a woman. Not sure if it's based on the endurance that a woman is having, or whether it's from the gender based, is whether the woman is expressing their pain enough for the physician or any healthcare practitioner to understand what the pain level they are going through. So that is my opinion. And also in regards to the different aspect, I think it's also about the gender based, and also it's about the race based too. So I really don't want this conversation to go into the racial discrimination fashion. But what I want to say is that if it's a gender based, and especially for the different racial, so it's again, everything is based on the endurance, that how a woman is being taken as like how much they would be endure their pain level. So that is what my opinion is about how the woman is taken, how seriously their symptoms are being taken into consideration. In regards to the other health factors, I'm not sure. I was just listening a last bit of the last speaker about mental health, which is again a little bit gender biased. I have seen that from a different perspective. It is a little biased between a woman and a man for in regards to the mental health, mental sickness. And I'm not sure exactly how many other factors I can count on where right in emergency in the different hospitals where I have seen it, that the woman is taken a little less seriously as compared to their male counterpart for the same health condition.
And can you explain a little bit about why this would be harmful to take women less seriously than men when we're talking about pain and endurance?
Uh, I'm not sure whether it's based on like being a woman as a childbearing, right from the beginning, from their menstrual cycle, how they are being taken in a different races, that this is a part of you and you need to tolerate this pain. So that maybe that might be the reason why the woman's pain is taken a little less seriously as compared to the men, is just because it's been considered that as a woman you already went through the menstrual pain and then it's a childbirth pain, then you need to understand that your bearing of that pain should be the higher level as compared to the men. But then also at the same time, how the men for the little pain, they are more expressive, the woman is less expressive, so that might be another factor as well.
And you touched a little bit about mental health. How is that differentiated between gender?
I would say in the gender as compared to the men and women, how they're being perceived in the healthcare setting is that if a man says this is what their mental issues they are going through, it might be anxiety, their depression, for the different disease, there have been schizophrenia. So, but if the same thing a woman express it, it's been like, okay, let's do the assessment. Let's try to find out the reason why the woman is expressing about the anxiety, about the depression, about the other mental illness, about their coping mechanism. Because in our society, it's been taken like, oh, women should be more into the mode of I would say, what should the word I should use? That women should be more adjusting, and they should not be expressing that because you are being made to be more adjustable and more taken into consideration of that. But as compared to the men, they are being taken like, okay, their voice is their voice, and what they are expressing, that is the truth. There is no endurance, there is no other cultural factors taken into considered.
And as a healthcare professional, would you say it's a part of the training to leave these biases at home?
Oh, definitely. I have studied from Ryerson here in the Toronto, and of course, even in our education, we had a different subjects even where they were emphasizing to keep your personal belief on the side, and also about the gender inequality, like to how to do the proper assessment. But that was a part of the study. But once you start experiencing, once you are working in a different setting, you get all these different factors that you start considering, and then it's the culture too. Like, I've been a nurse from last 23 years, and I can tell you the nursing 23 years and nursing today, it's quite different. And it's also, there's a different factors that the immigration has increased. There is a more awareness, the more technology that made people more aware of all these things. So everything is been evolving and the culture is changing as well. So I think it's the ongoing learning process that we all need to keep it in our mind. Like what we studied in our schools was that we need to keep it handy and not to be biased based on our socioeconomic structure, based on our gender, and based on our race as well.
And what advice could you give to a doctor or a nurse who may find themselves in a situation where they're uncomfortable or they're finding themselves judging their patient? How can they bring them back to their professional demeanor and stop using their biases in their work?
I think, honestly, I'm no one to give advice to anyone, but what I can tell you is about my personal feedback is that it's just that right now that the stress level at the workplace, in any hospital setting, I'm not talking about pandemic, I'm talking about the time before this pandemic, the stress level has gone up. the patient turnover has increased significantly, where we are more focused about the numbers and how they should be quickly being taken from one spot A to spot B and then to the discharges in the hospital setting. But where we all are missing a component of that as a not the number but as an individual, and each individual is very different, very unique in its own, and they have their own particular the factors that we all need to consider. And I think that is what will help us to do our assessment, and that is also what's going to help us to gain the trust of the public. And don't forget, we are in a multicultural society, and we need to be consider all these aspect and being respectful to each and every race and every socioeconomic status.
I think that's very good advice. And now looking at the other side, what advice could we give a patient maybe that's feeling judged? How can they convey this to their doctor without maybe starting a fight or being offensive?
I would strongly advise all the patients like not to stay quiet, and if you are expressing yourself and you find that your nurse or your doctor or any healthcare worker is not listening to you, what I would say, stop there and then again repeat yourself and do tell them that this is certain important aspect that you want them to be aware of. And rather than being judgmental like, oh, either this doctor is good or is not good, or is this doctor is listening to me or not listening to me, everyone has a right to raise their voice, raise their opinion. And I think it is very important that your voice needs to be heard, because every person who walks into the doors of the hospital or to the doors of the doctor's office, they are coming there with a concern that needs to be heard. And you need to make sure that your concern, your question is being listened and is being answered. It may not be the way that you want to hear, but at least it's been listened, and it needs to be addressed the way you are being expressing.
Right. Thank you so much. That's like amazing advice. It's been great to have you on the show, and we hope to have you back.
Thank you so much.
जिंदगी मुश्किल तो है, मंगल शनि राहु केतु, भूत प्रेत जिन्न, किसी की बुरी नजर, घर परिवार या व्यापार में भी मुसीबतें, घर और काम पे वास्तु दोष, सिगरेट शराब या किसी और नशे की आदत। हल है, मुझसे बात करें, मैं और आप मिलके ढूंढ लेंगे रास्ते। डोंट वरी, विल फिक्स इट। जिंदगी मुश्किल तो है, मंगल शनि राहु केतु, भूत प्रेत जिन्न, किसी की बुरी नजर, घर परिवार या व्यापार में भी मुसीबतें, घर और काम पे वास्तु दोष, सिगरेट शराब या किसी और नशे की आदत। हल है।
We've heard from the perspective of a patient and from the perspective of a healthcare provider. Now let's take a look at some facts. Health Canada clearly identifies one of the determinants of health as gender. Health Canada has also identified gender biases in the system, and these biases are identified in 4 ways. A narrowness of focus, ignoring women's, okay.
बेअसर हो जाते हैं, वहां से शुरू होता है होम्योपैथी का असर। बच्चों से लेकर बुजुर्गों तक, नए से लेकर कई पुरानी बीमारियों तक, जैसे एलर्जीज, एस्मा, आर्थराइटिस, हेयर लॉस, स्किन डिसऑर्डर्स, माइग्रेन्स, मेल या फीमेल हेल्थ इश्यूज, डाइजेस्टिव डिसऑर्डर्स या पाइल्स, मेंटल हेल्थ इश्यूज, हार्ट प्रॉब्लम, डायबिटीज और फॉर एनी काइंड ऑफ एक्यूट और क्रॉनिक डिजीजेस हमारे होम्योपैथ से मिले, जिनको 20 साल का लंबा तजुर्बा है। काव्या होम्यो केयर, जहां से शुरू होता है हेल्दी लाइफ का